Hi, I'm JC and I'm here to help you practice your English. Today we'll be covering a topic which is not an easy topic, but it's something that concerns a lot of people in society, and we'll be talking about disabilities. Now, some people don't like the word disabilities or disabled. It all depends on who we're talking to. Now, what is a disability? A disability is anything that we cannot do like a normal, able-bodied person. Now, we think of someone like me who wears glasses. I have to wear glasses to read because if I'm reading a book, I can't see too much without my glasses. And I became visually impaired when I turned 50. So I needed glasses at that time. Quite a few years ago, I had an accident and I hurt my knee and I had to use one of these. I had to use a cane, and I used the cane maybe for about a month, 6 weeks, and it helped me get to work and also to give my knee a break so that it would get better. Some people have to use other types of devices in order to cope in society. Now, in the hospitality, tourism, and travel industries, we talk about guests with special needs because these are people that require special things in their rooms or in the building in order to have a pleasant stay. And this could be one thing like ramps for wheelchairs or for people who have trouble walking, could be elevators, it could be special parking spaces, you name it. Also, it could be buildings that accept service animals, example, guide dogs for people who are visually impaired. The same thing corresponds for the residential and commercial sectors because buildings have to be accessible today. Now, what does that mean, accessible? That means people should be able to get into the building with no problem, even if they're not able-bodied. So we have access. You have access. You can get in or out of this building or the premises that you're trying to get to. So we have the word accessibility, we have the word access, and accessible. A building is or isn't accessible. And nowadays, especially since the 90s, buildings have to be accessible to everyone. And even cities like Montreal, Toronto, New York, Paris, London are adapting their public services pertaining to subways or bus routes so that everyone can use the public transit. Also, in the banking industry, for people who are visually impaired, we have something called talking ATMs, talking automatic teller machines. And these help people do their transactions when they go to the bank. Also, signage is important because directions need to be followed by certain people, or people have to know if they can park in certain places if they have a mobility restriction and say they use a wheelchair or some other device. Now, getting into the specific vocabulary, we talk about mobility challenges or restrictions, or someone who has a mobility disability, or they are physically challenged or physically disabled. Now, when we talk about people who are physically disabled, normally they use a device. I gave an example before of the cane that I used when I hurt my knee, but some people, it might be a cane, it might be crutches, it might be a walker, it could be a wheelchair, or even an electric scooter, because you see people around town in cities on electric scooters, which are almost like a wheelchair, except they're electric and they look like a little scooter. And people get around and it helps them if they are weak or they have trouble walking. Now, people who have a visual or auditory disability, example, if someone is visually impaired, totally visually impaired, we can say they're blind. But you can also be partially visually impaired, where, say for example, if you have cataracts, or say you're losing your sight because of illness, gradually you lose more and more, depending on the illness that you have. The same thing corresponds for someone who has an auditory impairment or an auditory disability. It can be at varying degrees also. Some people are 100% deaf. They cannot hear anything, and often they will use, maybe in their ears, special hearing aids to help them hear, or they will use sign language, or perhaps some people even can read people's lips so they can understand what people are saying to them. It is up to us to treat these people like ourselves, like anyone else, and just to be conscious that these people are reading our lips, or maybe we should try to pronounce a little more clearly when we're talking to them. I think of my father quite a few years ago when he was using the telephone. He had trouble understanding, especially young people on the telephone who work for companies. They would speak so fast that he could hardly understand anything, and sometimes he'd have to give the phone to my mother, who was a little bit younger than my father, and she was able to understand the people a lot more easily. So it's up to us to be conscious of who is listening to us if we're using the phone. Is it someone that's a bit older that maybe might have an auditory disability, or maybe an auditory impairment due to age or some other stage in life? It's hard to say. So it's up to us to be more conscious when we're dealing with the public, especially on the phone, of if they are totally understanding us. Because if we speak too quickly, or we have a very strong accent, it's more difficult for these people to understand. So we should take our time when we're speaking to people, especially if we're not speaking our native language, so that people can understand us and get the message that we want to get across. Another category to consider is people who have psychological issues. Now, this could be various stages of mental illness, or perhaps a mental problem that someone has since birth, or caused by an accident, say, for example, a car accident, or an accident at work, or it could be something like a disease, say for example Parkinson's or Alzheimer's, that starts later in life. So these cause problems for people, and at the same time, we as the public, we have to communicate. We have to communicate effectively with these people so that we have no problems with them. So we can say someone is mentally challenged, mentally disabled, they have mental issues, but we don't use any other terms other than that, unless we talk about their specific disease, if we know what it is. Say, for example, if I say Susan has mental illness, or Susan has Alzheimer's disease, instead of putting the disease first. Okay, in the next part of our activity today, what I'd like to do is I prepared 20 sentences for you, and I'd like you to repeat these sentences after me. Sometimes we're talking about various types of disabilities, and also devices that maybe people use to make their life a bit easier. Okay, so let's get started. Number 1, she uses a walker to prevent falling. Repeat. Number 2, Jim needed to use crutches after his leg surgery. Repeat. Number 3, the doctor told me that I would need to use a cane for a while after my hip surgery. Repeat. Number 3, he limps due to a sore knee. Repeat. Now, the verb to limp is to walk in a strange manner, usually from side to side because one of your legs or knees is not in 100% good condition. So someone will limp, to limp. Number 5, she uses a wheelchair to get around. Repeat. Number 6, Henry is visually challenged, so he needs a guide dog. Repeat. Number 7, she is visually impaired due to cataracts. Repeat. Number 8, they put a cast on his broken arm. Repeat. Number 9, having his dominant arm in a sling made doing everyday tasks more difficult. Repeat. Number 10, she was physically challenged after her car accident. Repeat. Number 11, he has had trouble speaking clearly since he had a stroke. Repeat. Now, do you know the word stroke? A stroke is something that happens when there's a loss of blood flow in the brain, and this can cause a disability, maybe a speaking problem or a mental problem after. Now, sometimes people get over a stroke and they're back to normal. Other people are left with a disability of some type. Number 12, she has always had difficulty understanding fast talkers on the phone. Repeat. Number 13, he tends to walk with an awkward gait. Repeat. Now, the word gait is the manner in which you walk. An awkward gait is a gait which is not normal. It could be caused by many things, maybe an accident or a problem since birth. Number 14, both their children have been hearing impaired since birth. Repeat. Number 15, her hip pain causes her to limp. Repeat. Number 16, he has been deaf since birth, so he communicates using sign language and reading lips. Repeat. Now, if you don't want to say deaf, you could say hearing impaired. Number 17, she has a service animal to help lessen her PTSD symptoms. Repeat. Now, what is PTSD? It's post-traumatic stress disorder. Repeat. Number 18, since her knee surgery, she has had a handicap placard in her car so she can park near store entrances. Repeat. Now, if you don't like handicapped, you can use disabled. Disabled placard. A disabled placard. A placard is a sign. Number 19, her migraines and fibromyalgia prevent her from working in direct sunlight or under fluorescent lights. Repeat. Number 20, her wrist splints allowed her to type despite her carpal tunnel syndrome. Repeat. So that's our activity for today. If you'd like to go back and practice with me again, like I say, you can do it as many times as you wish. So I'll say goodbye to you for today. Take care, and we'll see you in the next video.